All right, welcome to the Vecta Genesis. What I like about the Vecta Genesis is that it is pretty much idiot-proof. So let's get to the home page. On the home page, you have your electrotherapies, your ultrasound, your combination therapies, indications, and if you want to set it up for a specific patient, you have little cards that you can insert and it'll do that. Electrotherapies, let's start there. You have interferential, asymmetrical biphasic, burst, high volt, pre-mod, microcurrent, Russian stem, direct current, symmetrical biphasic, and then, of course, indications. Indications are specific conditions. What we're going to be working in lab is interferential, high volt, microcurrent, Russian stem. Let's go back to the home page. For indications, you have acute pain situations, chronic pain, to relax muscle spasm, to prevent disuse atrophy, to increase localized circulation, to do muscle re-education, or to work with someone who had a stroke to keep the muscles tonic and able to work. You can also do range of motion and then specific waveforms if you choose. For ultrasound, when you get ready to do ultrasound, you're going to hit the edit button. Go ahead and leave the head warming off, and the only reason why is because most people forget about it and you can burn up the head. Frequency, if it's at 1 megahertz, then it's for deep tissue. At 3.3 megahertz is for thin tissue areas, such as ankles, elbow, things of that nature. Duty cycle at 100 is going to produce the maximum amount of heat. Duty cycle at 20% is more for muscle massage, deep massage, without heat. All ultrasound therapies will produce a little heat, no matter what you put your duty cycle on. It's just that this one, you're really not going to feel it. Let's go back. So we're going to start with electrotherapy. You can do specific ones if you want to, so interferential. You can edit it. You can change your settings here. What I would recommend, because it works quite well, is indications. And then you can do acute pain or chronic pain. In this case, acute pain, edit, and all your settings are set for you, which is quite well. So let's go back. In this case, if you get confused as to how you're supposed to place your electrodes, it even tells you, electrode placement. Ta-da! Shows you how to do it. Now, this will only show you a general idea of how to place them, so if you're trying to do a specific area, it may not be in the picture, but it just shows you need to cross your pads, 1 and 2. So, here we go. We're going to set her up, let her know. I'm going to tuck your shirt into your clothing. There we go. Now, you'll have 2 sets of leads, gray and black. Take the black lead first. Let your patient know this might be a little cold. And what we're wanting to do is we want to isolate wherever the X is where you're going to be working. Take the red lead for the same side. Let your patient know I'm going to go a little deep under your clothing here. And just slide it up underneath there. Lock it in, a little cold. And that's just making sure your patient is comfortable. You're going to go on the same level on the opposite side of the spine at the same level as the other pad. Again, we're going to go a little deep here. Place it there because you want to get right into those muscles. So now you've got an X in the pattern that it's going to go. Now, you're going to hit start. And you're going to let your patient know you should start to feel a little bit of a tingle at about there we go. You feel it?
Mm-hmm.
Okay. Let me know when it starts to get a little painful.
Okay.
All right, then you just back it down a little bit. You good right there?
Yeah.
All right. So you want to go to patient's tolerance and then back it down just a little. And then after about a minute or so, come back and ask them, you doing okay?
Yeah,
and they may say, you can turn it up just a little bit, because their body is going to start to get used to it. Now, the fact that it is ramping up and down and switching sides makes it so that the body doesn't get accustomed too quickly. And you're going to be on this for about 30 minutes. So just sit back and relax. Make sure your patient has their phone if they want to play on it. Just give them something to do.